Hello, this is Dr. Jim Collins, and I'd like to talk to you for a few moments about something that's very important to me. I think it might be important to you as well. It's Alzheimer's disease. And especially what I'd like to address is communication and Alzheimer's disease, because it's going to change as the disease progresses from mild to moderate to severe. We're going to see lots of changes in communication. We're also going to see some challenges in communicating with individuals who have Alzheimer's disease. Then I'd like to talk a little bit about some strategies. How can we adapt to the changes that are taking place and more effectively communicate with people who do have Alzheimer's or related dementias? Here's some changes, and remember that these changes will be different with each phase or stage of Alzheimer's disease. But everyone's different. Everyone communicates differently. Changes that take place in communication with Alzheimer's are very unique to every individual. Some changes might be very overt, and we see them early on. They're very visible. Others will be more covert, and we might not detect these changes yet. There might be difficulty in finding words, using familiar words over and over again, losing train of thought very easily. These are common things. Inventing new words is something that I've seen, perhaps you have as well. Reverting to one's native language. If the individual was born in another country and they spoke that language fluently, and then they came here and learned English, many times we see the individual reverting back to their native language. And of course, yelling and cursing and screaming and things like that can occur. It's very understandable. As well as using fewer words or just relying on a handful of words that they still remember, okay? In terms of challenges, the challenges will be different with every stage of Alzheimer's as well. Some of them include being difficult to follow certain conversations or having difficulty following these conversations. The individual might need more time to form their thoughts and to respond to us. Staying on topic can be very difficult. Finding the right words, losing train of thought, unfortunately becoming frustrated, perhaps yelling or striking out, becoming physical is not untypical. Maybe they cannot understand the meaning of most words anymore, and they don't acknowledge when they are being addressed. And unfortunately, during the final stages of Alzheimer's, most, if not all, language and communication will be lost and the individual will become mute. Strategies. Remember that there are mild stages, moderate stages, and severe stages of Alzheimer's disease. So the strategies will be different for every stage. Verbal strategies are always more effective during the early stages of Alzheimer's disease. As dementia progresses, though, all forms of communication will become more challenging, but especially verbal communication. It's important that we remain patient, sensitive, and compassionate. It's not their fault. Their brain is going through neurological changes. Nerve cells, neurotransmitters are being destroyed. So try to gain their attention. Speak naturally and slowly and calmly. Always keep the message very simple. And perhaps most importantly, be positive. Remain positive and try to get them to be happy too. So I wrote an article on this and some other areas and topics within Alzheimer's disease and dementia. So if you'd like some more information, go ahead and follow the link to my blog. If you're a licensed healthcare professional and you'd like some CEUs, go ahead and follow that link to obtain them. My name is Dr. Jim Collins. Thank you so much for spending time with me. I'll see you soon.